Puberty is appearing ever earlier in girls in the U.S., with researchers at Kaiser Permanente in San Francisco saying signs of puberty are regularly showing up in girls as early as 7 years old. What are the reasons and long-term health consequences of this? Joining us now to discuss is WSJ Health reporter Sumathi Reddy. Hi, Sumathi. Great to see you. So is this early onset of puberty happening to boys as well as girls?
So the data on boys is not as clear. There was one study several years ago that found it may be happening earlier for them as well, but not as much. The data is not as robust as for girls, and there's some indication that the health consequences aren't as impactful on boys. So that's why the focus research is on girls.
Right. Okay. So what are the short-term consequences and sort of the long-term health consequences of early onset puberty?
Sure. So in girls, there was a study that just came out recently that showed they had a greater risk of, if they went into puberty early, they had a greater risk of developing depression in adolescents as teenagers.
What about also risky behaviors? Do they engage?
Yeah, so I mean, part of their brain is developing faster than other girls, but then the other part of their brain that sort of controls impulses is not. So there is this increase in risk-taking behavior, smoking, drinking, sexual activity, that sort of stuff. Depression, anxiety, all those psychosocial sorts of things. And then long-term, there's some evidence that it leads to greater incidence of breast cancer, obesity, type 2 diabetes. There's a lot of long-term consequences as well.
And is the breast cancer related to the fact that there's just more exposure to estrogen, more years of exposure to estrogen?
That's the theory, yes, and that's still being studied.
So researchers say primarily obesity is to blame for this, is that right?
Yeah, so there's big racial differences. So African-American girls tend to definitely show an earlier onset for puberty, and then the other big factor is obesity, yes.
Right.
So because fat releases estrogen, it can lead to an earlier puberty start.
But researchers are also looking into certain environmental factors, which I find really interesting. I mean, there isn't conclusive evidence yet here, but they are exploring some other issues as well.
Well, I thought it was really interesting that toxic stress is considered. There's also very good evidence that growing up without a biological father, in a violent situation, in poverty, those are all factors that lead to earlier puberty.
That is very interesting. And also they say that some products with phthalates and other endocrine disruptors can...
Yeah, so we hear a lot about that. Now, they're not as conclusive on that. Yeah. There is some indication that there are those things that are in a lot of cosmetic products and sunscreens and pesticides that may play a contributing factor.
And what about prenatal health? Are researchers also examining that?
So that's a new thing as well. There was a study that just came out looking at that, and it found that mothers who were both overweight or obese and that developed gestational diabetes while pregnant had their daughters had a greater chance of having puberty earlier.
It's so interesting. It's so fascinating. Now, for parents who have prepubescent daughters and would like them to have a sort of a normal, what's the normal age of menarche? 12 or so? Is that?
That hasn't changed much.
That hasn't changed much?
That dropped a lot in sort of the early 20th century, but now it's sort of plateaued. So it's 12 and a half. What these researchers are looking at is sort of the breast development when it starts, and that's considered the first sign.
Because puberty does last, what, an average of 4 years?
4 years about, yeah, for girls.
For girls, okay. So some of the advice that doctors have for parents, who obviously there's only so much you can do.
Yeah.
Part of it is genetic, right? And there is that factor.
A lot of it is genetic.
Is to make sure that your child gets plenty of exercise and eats lots of fruits and vegetables. And
so it's sort of the same things like general good health, which is, eat healthy, eat a lot of fiber. There's some indication that fiber helps. Eat a lot of fruits and vegetables, and sort of watch, in terms of the products you're using, try to look out for those things that are red flags.
And what about eating organic? They do say that for the dirty dozen, which I guess are those fruits and vegetables that tend to be more regularly exposed to pesticides, those we should try to buy organic.
Yeah, one doctor said, the 12 vegetables and fruits that have the most pesticides, you might want to just buy organic for those 12.
Right. Now, also I thought it was interesting not to microwave plastics, one doctor recommended.
Yeah, so that's known to leach phthalates, that's one potential culprit.
All right, great advice and very interesting research, Sumathi Reddy. Thank you so much for that.